Hello and welcome to our podcast. In this episode, we're going to be talking about depression and why it's important to discuss mental health. Depression is a mental health condition that affects millions of people worldwide. It can cause feelings of sadness, hopelessness, and even thoughts of self-harm. Unfortunately, there's still a lot of stigma surrounding mental health, and many people don't seek the help they need. That's why we wanted to make this episode, to raise awareness and encourage people to seek support if they're struggling.
Absolutely. Mental health is just as important as physical health, and it's important to take care of both. Depression can be a very isolating and overwhelming experience, but it's important to remember that you're not alone and that there are resources and treatments available to help you.
That's right. And in this episode, we're going to be talking about what depression is, its causes, and treatment options. We'll also discuss healthy coping mechanisms and the impact depression can have on different areas of a person's life. But before we get into that, let's talk a bit more about why it's important to discuss mental health.
That's right. And in this episode, we're going to be talking about what depression is, its causes, and treatment options. We'll also discuss healthy coping mechanisms and the impact depression can have on different areas of a person's life. But before we get into that, let's talk a bit more about why it's important to discuss mental health.
That's right. And I think it's important to acknowledge that talking about mental health isn't always easy. But the more we have these conversations, the more we can break down the barriers and start to make progress. So let's dive into our discussion on depression and see what we can learn.
Depression is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities that once brought pleasure. It's a complex condition that can manifest differently in different people.
That's right. And there are several different types of depression that people can experience. For example, there's major depressive disorder, which is characterized by a depressed mood or loss of interest in activities for at least 2 weeks. There's also persistent depressive disorder, which is a milder form of depression that lasts for at least 2 years.
Additionally, there's seasonal affective disorder, which is a type of depression that's triggered by changes in the seasons. And there's postpartum depression, which is a type of depression that some women experience after giving birth.
It's important to note that these types of depression are not mutually exclusive, and someone can experience multiple types of depression over their lifetime.
That's right. And diagnosing depression typically involves a combination of a physical exam, a psychological evaluation, and a review of a person's medical history. Doctors will often use standardized questionnaires or scales to assess the severity of a person's depression.
Some common symptoms of depression include feelings of sadness or emptiness, fatigue or lack of energy, changes in appetite or weight, and difficulties sleeping. Other symptoms may include irritability, difficulty concentrating, and thoughts of self-harm or suicide.
The causes of depression can be complex and multifaceted. Some common risk factors include a family history of depression, certain medical conditions or illnesses, and stressful life events. Additionally, imbalances in brain chemicals called neurotransmitters can also contribute to depression.
While depression can be a challenging condition to manage, there are many effective treatment options available. In the next segment, we'll discuss some of the treatment options for depression and how they work.
Depression affects so many people, and hearing other stories can be incredibly helpful in breaking down the stigma and raising awareness.
I'll start by sharing my own personal experience with depression. A few years ago, I went through a particularly stressful time in my life, and it felt like I was carrying the weight of the world on my shoulders. I remember feeling incredibly sad, hopeless, and unmotivated. I didn't want to talk to anyone or do anything. It was a very isolating experience.
I can definitely relate to that feeling of isolation. When I was struggling with depression, I felt like I was in a deep, dark hole, and there was no way out.
It's tough, but it's important to remember that there is a way out. Recovery is possible. And while everyone's journey is unique, there are certain things that can be helpful for anyone going through depression. Let's start by talking about medication. Medication can be very effective in treating depression, and it's often the first line of treatment for moderate to severe cases. Antidepressants work by changing the levels of certain chemicals in the brain that affect mood. However, it's important to note that medication is not a one-size-fits-all solution, and it may take some trial and error to find the right medication and dosage.
That's right. It's also important to be aware of potential side effects of medication, such as nausea, headaches, and sexual dysfunction. And medication should always be taken under the guidance of a healthcare provider.
Absolutely. Another treatment option for depression is therapy. Therapy can be very helpful in identifying and changing negative thought patterns and behaviors that contribute to depression. Cognitive behavioral therapy, CBT, is a common type of therapy used for depression and has been shown to be very effective.
Yes, therapy can be a very empowering and supportive experience. It can help people develop coping strategies and build resilience.
And there are also lifestyle changes that can be effective in managing depression. For example, regular exercise has been shown to be beneficial for improving mood and reducing symptoms of depression. Eating a healthy, balanced diet and getting enough sleep are also important for overall mental and physical health.
And it's important to remember that self-care is not a luxury, it's a necessity. Taking care of oneself can be a very important part of managing depression.
Definitely. And for some people, a combination of medication, therapy, and lifestyle changes may be the most effective approach. It's important to work with a healthcare provider to develop a treatment plan that is tailored to each individual's needs. We discuss different treatment options for depression. In this segment, we'll focus on healthy coping mechanisms for those who struggle with depression. We discuss different treatment options for depression. In this segment, we'll focus on healthy coping mechanisms for those who struggle with depression.
Coping mechanisms are ways to deal with difficult emotions and situations. Healthy coping mechanisms can help manage depression and prevent it from worsening.
One healthy coping mechanism is mindfulness. Mindfulness involves paying attention to the present moment without judgment. Practicing mindfulness can help reduce stress and improve mood.
Yes, and meditation is another useful technique for managing depression. Meditation can help quiet the mind and reduce negative thoughts and feelings.
Exercise is also an effective way to cope with depression. Regular exercise has been shown to improve mood, reduce anxiety, and increase energy levels.
And creative outlets like art, music, or writing can be a powerful way to express emotions and reduce stress.
Seeking support from loved ones and mental health professionals is also an important coping mechanism. Talking to someone who understands and supports you can be very comforting and can help you feel less alone.
Yes, and it's important to remember that asking for help is a sign of strength, not weakness. There is no shame in seeking professional help for depression.
And for those who prefer a more natural approach, there are also alternative therapies such as acupuncture, massage, and herbal remedies that may be helpful.
Depression is a serious mental health condition that affects millions of people worldwide. It can have a significant impact on a person's work, relationships, and overall quality of life.
Depression is a serious mental health condition that affects millions of people. Let's start by talking about work. Depression can make it difficult to concentrate, make decisions, and complete tasks. This can result in decreased productivity, increased absenteeism, and even job loss. Worldwide. It can have a significant impact on a person's work, relationships, and overall quality of life.
Depression can also impact relationships. It can make it hard to connect with others, and may cause feelings of isolation and loneliness. It can strain friendships, romantic relationships, and even family relationships.
And the impact of depression isn't limited to just work and relationships. It can also impact a person's physical health. For example, depression can lead to changes in appetite, sleep disturbances, and decreased energy levels.
And all of these factors can have a significant impact on a person's overall quality of life. Depression can make it difficult to enjoy hobbies and interests, and can make even the simplest tasks feel overwhelming.
However, it's important to remember that depression is treatable. With the right treatment, many people are able to manage their symptoms and improve their quality of life.
Treatment options may include medication, therapy, or a combination of both. It's important to work with a mental health professional to find the right treatment approach for you.
We'll discuss the stigma and misconceptions surrounding depression.
Stigma and misconceptions can make it difficult for people to seek help for depression. Let's talk about some of the most common ones.
One of the most common misconceptions about depression is that it's just a case of feeling sad or down. But depression is more than that. It's a serious mental health condition that can have a significant impact on a person's life.
And another common misconception is that people with depression are weak or lazy. But depression is not a choice, and it's not a sign of weakness. It's a real illness that requires treatment.
Stigma is also a major barrier to seeking help for depression. People with depression may feel ashamed or embarrassed about their symptoms, and may be afraid to seek help for fear of being judged or stigmatized.
And, unfortunately, this stigma can come from a variety of sources, including society, family, friends, and even healthcare providers.
But it's important to remember that depression is a treatable illness. Seeking help is a sign of strength, not weakness.
And there are many effective treatments available, including medication, therapy, and lifestyle changes.
If you or someone you know is struggling with depression, it's important to reach out for help. Talk to a mental health professional, a trusted friend or family member, or a support group.
And don't let stigma and misconceptions stop you from seeking the help you need. You deserve to feel better.
We discuss depression, its symptoms, causes, and treatment options, as well as healthy coping mechanisms, the impact of depression, and the stigma and misconceptions surrounding it.
It's important to prioritize your mental health and well-being. Remember to practice self-care, seek help if you need it, and be kind to yourself.
And don't forget that recovery is possible. With the right treatment and support, you can overcome depression and live a fulfilling life. That's all for today's episode. Thank you for listening, and stay tuned for more content from our podcast.